I'm Dr. Kathy Gradkowski, a chiropractor at the Florence Chiropractic Center, and I want to talk to you about using ice versus heat. This is a really common question I get on a daily basis. Should I use ice or heat? So as a rule of thumb, when you have pain or injury or swelling, you're going to use ice. When you have tightness and stiffness, you're going to use moist heat. So moist heat, I mean a moist heating pad that actually has a sponge in it that kind of produces a little bit of moisture around the area. A dry heating pad will evaporate the moisture of the muscle, and it will actually make you feel better, but it'll make the joint tighter after you're finished. So I don't recommend dry heat, moist heat. But as far as ice, if you're going to use ice because you have pain or inflammation or an injury, I recommend that you always take your ice pack or your bag of frozen vegetables or anything frozen and cold, and you always wrap it in a damp or wet towel before you put it on the skin. So you want this damp towel actually on your joint. If it's an elbow injury, you want that damp towel or even a damp paper cloth to wrap around the ice. You never want to put an ice pack or a bag of frozen vegetables directly on your skin. You can get an ice burn that will cause a blister, just like a heat burn. So if you have direct ice or a direct ice pack without that towel, you do run the risk of causing an ice burn. And I've seen that many times and it's painful, so never do that. You want to put a wet towel around the area, put that around your back, your neck, your knee, your elbow, wherever you need the ice or wherever the injury or the pain is. You want to leave the ice pack on for 3 to 10 minutes. Basically, you want to go through a few phases. We call it C-band. C for cold, obviously right away it's cold. Then it's going to start to burn already right now because my elbow is not very thick and fatty tissue. It's starting to burn, so C-B-A. If I leave this ice on another minute or two, it's going to start to ache. And then N for C-band is numbness. And after 3, 4, 5 minutes, it's going to start being numb. That's when you know the ice has done its job. That's when I can remove the ice. So we say 3 to 10 minutes, but you really want to go to the numbness phase. C-band, cold, aching, burning, numbness. Don't be tempted to take that ice off when you're in the aching or burning phase. Give it another minute because that ice is really going to penetrate and get some of that swelling down after you go to the numbness phase, the C-band phase.